first part of it is, I think, for any patients that are going to be using conventional medicine for whatever they're struggling with, is to do your own research and figure out what exactly are you interested in taking as a home remedy, in addition to your conventional treatments. And one of the things to do would be to make sure there's no drug interactions that could happen with any, prescriptions that you're taking. And Memorial Sloan Kettering Cancer Center website actually has an amazing database with all different alternative remedies, herbs, and supplements, and you can search for them, and then it'll give you a list of potential drug interactions. So I think that's, one place to start if you're just like, is this okay for me to take? And then bringing it up to your doctor. Of course, every condition is different. Sometimes you need to bring it up to your doctor because it's very serious. Sometimes it's something, more general that you can just manage on your own. But we brought it up to my dad's oncologist. And this is where I do see people running into some challenges, because a lot of doctors don't know enough about cannabis and medicinal mushrooms to be able to give a recommendation, or they just actually aren't allowed to give that kind of recommendation due to their, the protocols at their hospital or their training. They just can't say, yes, you should do this. So a lot of doctors will say no because they just want people to be conservative. So I always tell people that if your doctor says no to using any of these things, ask why, and ask if there's a specific reason that's connected to you and your personal condition on why you can't take this. Or ask them, do you just not know enough about this, which of course is fine, but is this just, you just don't have enough information, or is there actually a risk that you know of? And if there is, can you send me or direct me to some of that research so I can look into it? Because a lot of people will just hear the no from their doctor and they won't ask why. And they'll say, oh, I'm not allowed to take this. And so I'm always like, just push a little bit further. Maybe the doctor's correct. Maybe you shouldn't be taking it. Maybe there's a medication that it'll interact with, but maybe not. And I would say just keep asking questions until you understand. I think that's the most important part. My dad's oncologist said, listen, I can't tell you that any of these things are going to help. I can tell you that they probably won't hurt. So do what you want, and let's just keep checking in, at each appointment, at each scan. If things are getting worse or something is going wrong, we'll stop them. And that hasn't happened. So I think, just making sure you kind of have like your whole team kind of on board and everybody understanding, why you're doing what you're doing.
I think that's so important to ask your doctor why. If they tell you no on something, or even if they give you any kind of information, is to dig deeper on why. And to your point, I think a lot of people will just kind of accept what the doctor says. And sometimes there's a reason and they're right, but I think it is important to go a little bit further and ask why.
Because some of these plants, they've been used, like I said, for thousands of years, and there's a high amount of deaths every year just from, pharmaceutical drugs being misprescribed or, medical accidents. And, it's just not like the conventional medicine is like totally foolproof. There's things that can happen with any kind of treatment. So I just think it's important to do some research, to look into it, and to check in with yourself about what feels right for you. Because one of the things is, belief is a huge part of healing. And if you believe in your treatment, that's going to go a long way.
For sure. I'd like to spend a few minutes around the topic of cannabis and the benefits of cannabis. We've talked about CBD and how it can have, benefits of calming effects, reducing anxiety and stress. So maybe we can just talk generally about cannabis and the benefits that it has. For me, I feel like since I've started taking or using cannabis, I am I'm a kinder person. I'm more patient. I am more loving. I just feel happier, honestly. And it's been a few years. I would say it's almost 2 years now that I've been using cannabis. So maybe we can talk about some of those benefits and any other benefits that you're seeing either personally or other people you talk to.
Yeah. First of all, that's beautiful that it's had such a positive impact on your life. I hear a lot of stories of people saying the same. Well, when it comes to cannabis, I think something that's important to know is there's hundreds of different compounds inside the plant. So some people get confused, like what's hemp versus marijuana versus cannabis. There's like all these different terms. Cannabis is just the overarching name for this species of plant. And there's yeah, like I said, hundreds of compounds within it. So some, strains of cannabis can have really high THC levels, which is the compound that makes you feel high. Some can have very high CBD levels, which does not make you feel high, but still has a bunch of therapeutic benefits. And then there's a bunch of different ones that are in between, so you could have like a 50-50 split, or, there's all different kinds. So I think that's important to understand. There's all different ratios, and for every person, a different ratio is going to work better, and in different methods of delivery as well. So like you may, for instance, I guess I'll start with saying that one of the things that people use both CBD and THC for is pain. Whether it's joint pain or muscle pain or whatever kind of pain, arthritis, people use, capsules or tinctures or topicals, depending on what kind of pain it is. And you can use, with topicals, you can use something with a higher THC level and not feel the intoxicating effects as you would when you're, inhaling or taking a tincture. So, some of it can, of course, get into your bloodstream, so you might feel a little bit of something. But I use high THC topicals for all kinds of different pain, or like muscle pain, or menstrual cramps and back pain. I have I broke my tailbone a few years ago, so when I sit for too long, it can get like really achy. So I have a high THC topical. You have to get that at a dispensary. That really works wonders on that kind of pain. So you can use, like I said, different ratios. And sleep is another big one that people use it for. Some people, I use a CBD tincture for sleep every single night. It just helps to kind of like calm my mind and calm like any body anxiety that I have that's like kind of keeping me on edge. The CBD will calm that so I can fall asleep. Some people like to take higher levels of THC for sleep. I personally don't, because if I start to feel the THC, that is more activating for me. But for some people, it really puts them to sleep. So you really have to experiment. So